Huh?
All right, welcome everyone to join our support group each month. And I cannot wait to hear today's presentation because I think a lot of the parents are facing the same situation when our kids are really emotional or having some difficult behavior. What do we do? So thank you, Catherine, and also Ariel. So great to invite all these great speakers to teach the parents to handle the situation. And Ariel, you want to do an introduction?
Sure. So, Catherine, I'm going to give like a shorter version of your bio. But I know Catherine because we work together at the Treatment and Learning Centers and over here in Rockville, and she was our lead occupational therapy lead occupational therapist in the outpatient clinic. And she is now working at the Davies Institute for Speech and Hearing in Houston, Texas. So she's helping develop the sensory gym there and works with school-based and outpatient clients. Catherine is an American Occupational Therapy Association board certified in pediatrics. And she's presenting for a statewide conference in Texas for the education of the deaf in July about dysregulation. So we're really lucky to hear some of this information today. And one thing that I personally learned a lot from Catherine and generally from OTs that I've worked with is a lot of times we think that what a kid is doing is behavior, that like they're, like choosing to be a certain way. But I'm realizing now, after talking to Catherine and working more with other OTs, that really the kids are probably dysregulated and overstimulated, and that they're actually great strategies to help them come down from that and regulate. And I've learned that regulation always comes before expectations. So before any teaching or learning can happen, the child and myself, we all have to be very regulated. So Catherine, I'm going to turn it over to you now. Thanks for coming.
Well, thank you for having me. Ariel, that was such a nice introduction. All right, I'm going to pull up my slides, so just give me one moment so I can share them with you. Oh, where did the share go? There we go. All right. Okay, so we are going to be talking today about how to recognize and de-escalate an overstimulated child. Should I give a few more minutes as people are entering, or just keep going? What do you think?
I guess we can go ahead.
Okay, so what we're going to be going through today is I'm going to briefly introduce myself, even though Ariel did such a great job. We're going to talk about what is overstimulation, what can it look like, how can I, the adult, help de-escalate the child. I have a case study about, generally about a former client of mine that we're going to kind of work through after we talk about all of this info and these definitions. And then I'll have some time at the end for questions. At that point, we'll have to stop the recording in case people are asking about their children or people in their lives. But I will be here for questions because that's usually where a lot of the learning happens. Okay. So hello, I am Ms. Catherine. As Ariel said, we did work together at the Treatment and Learning Centers in Rockville. And in September, I moved to Houston, Texas, and I currently work at the Davies Institute for Speech and Hearing. This is a picture of my dog, Peanut. I am very sorry if she makes herself known. She is very loud and yappy. So we may have a four-legged guest at some point during this presentation. I will do my very best to keep her quiet. She's currently taking a nap. Let's hope that it stays that way, but we may see Peanut. Okay, so let's talk tantrums, meltdowns, dysregulation. What are all of these things? What does it mean? And what do we do? So we're going to start with some definitions. Your arousal level is how awake or how alert you are. So when we think of an infant, right, we think of like different arousal levels. They're either in that deep sleep, that light sleep, that very, kind of alert and playful, and then that very alerted state. Same thing for children and adults, right? So it's how awake and alert and able we are to participate. Sensory processing is the ability to register, right, what information is coming to me, interpret it, understand what it is, discriminate between different types of sensory input, modulate, going from one end of an to the other, and kind of coming into the middle, and then responding to input. So when we talk about sensory processing, a lot is happening. So our sensory processing, our ability to register, interpret, discriminate, modulate, and respond to all of these different sensory systems affect our arousal level. And when we are in a regulated state, we're in an optimal arousal level state. We're not too high and we're not too low. So we actually have 8 sensory systems. I'm not going to go too into it, but when we're thinking about sensory processing, there's 8 different areas of information that our body has to receive and interpret and modulate and discriminate and go all the way through. So we think of the 5 that we know, right? Touch, taste, hearing, sight, and smell. Those ones kind of, we're all learned that.
Right.
So there are 3 internal sensory systems. Vestibular, which is another really known one, right? That's in our inner ear. It tells our head where we are. So if we're upright, our head now knows that we're upright. When we invert our head, we're activating our vestibular system. So it has a lot to do with balance. Proprioception is the information that comes from our joints. So when your joints are pushed and pulled, that's your proprioceptive input. That's telling your body where you are. It helps with your coordination and your motor planning. Interoception is the organ information. So that's when you have a hunger or a thirst cue or urgency to go to the bathroom. So those organs are receiving information. They send the signal to your brain and you have an emotional elicited response. So we've got 8 sensory systems that we're working through. So our arousal level fluctuates throughout our day, as it should. If we were at the same arousal level at 10 p.m. that we were at 10 a.m., it would be really difficult for us to sleep, right? So it's supposed to fluctuate throughout our day. When we're in that optimal arousal level period, that's when we're calm, alert, focused, and we're organized. We're able to sequence things. We're able to have access to higher level skills, like thinking about things or learning things. So overstimulation is what happens when the body receives too much sensory information that it can process. And remember, we've got 8 systems. So there's a lot of things happening simultaneously. We become overstimulated when it's just too much. Our overstimulation can cause dysregulation. So dysregulation occurs when the body has difficulty organizing, interpreting, perceiving, and modulating sensory input. That can result in a meltdown. So sometimes I like to think of it as overstimulation is what's happening. Dysregulation is what we, the adults, see. So that's what we're feeling. So we're feeling overstimulated, we see dysregulation. Okay, so to give some context, right? If we're adults driving in the car and we don't know where we're going, right? And the volume of our music that we're enjoying is really loud, and now we have to turn it down to be able to focus on where we're going, we were overstimulated by the music. So we turned it down, and then we're able to listen to the directions and figure out where we're going. By changing that sensory stimuli pretty quickly, we were able to transition and keep moving. When we're dysregulated, we also have that emotional component, right? We're feeling frustrated because we're sitting in the car and now we're going to be late to work, right? So if I change the sensory stimuli by lowering the music, I'm still needing to use that coping strategy because I'm getting nervous and uncomfortable that I'm going to be late to work. Let's put the 2 together, right? So this is obviously an exaggerated example, but you burnt your tongue on your coffee, you're not wearing comfortable pants, you've got a blister on your toe, you forgot your sunglasses and the sun is in your eyes, you had to lower the volume, and you're going to be late to work. We are feeling overstimulated and dysregulated, and we are not off to a good start in the morning. So a tantrum versus a meltdown. I know sometimes people think that these mean the same thing, but in the OT world, they don't. They're two different things. So a tantrum is a behavioral response when a person is frustrated or agitated. We see this a lot, right? The terrible twos, right? Where they're starting to want to do things more independently. They get frustrated and they throw themselves to the floor and they cry, right? This can be supported through some soothing, going different choices, or at times you have to briefly ignore that and let them problem solve, and we're able to figure it out. Even though we're still frustrated and agitated and we're having moments of dysregulation, this is not a sensory meltdown. So a sensory meltdown is an uncontrollable response from significant overstimulation that is having a nervous system response, right? So this isn't a cognitive choice to be frustrated, upset, and laying down on the floor. This is our nervous system overriding that and putting us in fight, flight, freeze, or fawn, one of those responses. This is going to require a lot more cues. We're going to have sensory strategies, and we need to help with safety, because right now we're not able to take in a cognitive strategy like a verbal cue. Oh, I'm sorry that this is happening. We're not going to be able to use those strategies when we're having a meltdown. This is where we see some severe dysregulation. So this is our hierarchy of developmental skills, right? So at the bottom, although interoception isn't there, we need to update our hierarchy. We've got our sensory systems. You will see proprioception and vestibular down there. So this is our foundational skills. If we look at the very top of this pyramid, that's where we see academic learning. So we have to think about all of the skills that we need for our children to be able to learn. Right underneath that is daily activities and behavior, right? So if we have some issues going along at the bottom, if we're overstimulated and one of those pieces is pulled right out, our hierarchy is going to fall. It's going to be really hard to have an appropriate behavioral response if we're not having a solid foundation at the bottom. So, dysregulation, what does it look like? It can look a lot like a tantrum, which is sometimes why it's confusing, right? You have some restlessness, irritability and agitation, difficulty focusing, crying or laughing inappropriately, running or fleeing, that's also called eloping, biting, hitting, kicking, pushing, stripping off clothes is a big one, just because children might be overstimulated by what they're wearing, and that's also a means of control, so off goes the shirt. We also have physiological responses. We may have a pinned affect where they just look startled, or they may look literally confused. We might see that they're frozen, right? That's that fight, flight, freeze, or fawn. We may see them actually start to get sweaty, or they're starting to wipe their hands because their hands feel clammy. Sometimes children may be nauseous or vomit. We can also see sometimes that children will hair pull. Sometimes it's because of a headache. Other times it's because of, I always say this wrong, but trichotillomania, I think, which is hair pulling as a sign of anxiety and stress. It's a psych term. So what are some of the causes? This is not, the only list, right? I just kind of summarize them as best I can, but let's think about those 8 sensory systems, right? We have loud or unexpected noises, external movement. If kids are moving around really, really fast and they're unable to visually process what's happening, that can cause overstimulation. Bright lights, strong smells, crowds or crowded spaces. If they're not exactly sure where their body is in this environment, they may feel very threatened. They could be overstimulated and dysregulated. Tactile input. Sometimes our kids really don't like the tags on their shirts or the lines on their socks. Those things can be extremely abrasive to them, and that can cause overstimulation and dysregulation. Multitasking. Remember, cognitive processes were at the top of that hierarchy. So if we have to think through too many steps and we're not understanding what's happening, we can become overstimulated. Transitions, that's a big one because of shifts and demands, 2 different things. So a demand isn't just what you're doing, it's environmental demands like the bright lights or a lot of people. It's the social demand. Do I have to participate with another peer while I'm doing something? It's a cognitive demand, like all of those thought processes, like the multitasking. So there's a lot of things happening with transitions. Shifts are going from one thing to the next. I have to close the book, shift. I have to put the book, shift. I have to open the door to leave the room, shift. So all of these shifts that are happening within one transition could be really bothersome for whatever those, within whatever those 8 sensory systems are, which could lead to overstimulation. And then we have emotional dysregulation. If you're already upset about something and then the bright lights are bothering you, it makes sense that we're going to be overstimulated and become dysregulated. So really important. How can we help? What can we do as the adults to help the kids process through this? The first thing you have to do is you have to help yourself. Okay. So co-regulation between a child and an adult comes before self-regulation. So right now they are not at the point where they're going to be able to calm themselves down. We have to help them. So if they are at 100% overstimulation and dysregulated, we need to be at like a 20. We have to help them calm down. To do that, you're going to be in a stressful situation. Help yourself first. Take a deep breath and observe what the child is happening. Unless it's a safety issue and you have to have a safety plan right away, take a moment and look at the situation. What is happening? So what can we reduce, right? Back to our hierarchy. We need to reduce the things that are at the top of that list. One very obvious, a triggering stimulus. If something is very clearly bothering the child, let's change the triggering stimulus. Demands, remember, demand is not just what you're doing. It's a verbal demand. If you're talking too much, if you're asking too many questions, if there's too many choices, it's too much to think about, start to slow down. What are the social demands, right? Asking for a please and a thank you when a child is overstimulated is probably not going to help. This is just not that opportunity. We need to take that demand away. Do you want this? Yes or no? Okay, no. Thank you for telling me. And then we're starting to move away from that. And academic demand, if a child is very triggered by all of the cognitive processes for what's going on with academics, we need to take a step back in that moment so that we can help de-escalate. Our language, we need to stop talking as much and stop narrating every single moment and kind of go to more of a consoling. So we need to change the volume, the projection, the frequency of the language that we're giving this child, because they're reaching a point that they're no longer going to be able to take in that cognitive support, right? All of that language. We're going to start to hit a point where we're going to need sensory supports. And then, right, we're going to take a step back and observe, what are the environmental aspects? Is there something that I can reduce quickly that might help them de-escalate a bit more? Are the lights really bright? What if I just turn off the lights? I'm going to turn off the lights, turn them off, watch and observe, see how the child is starting to respond. It's not going to be very, very quick all the time. Give them time to process what's happening. Oh, excessive sound. What if I just close the door for a little bit? Now it's just us in this room. Are we able to breathe and calm down a little bit after we kind of close this door? And take in your environment, right? What can we increase? Back to the bottom, right? We want to have that strong foundation so we can actually increase our distance from the demands. If it's a social demand, the child may need some more space from the group or from the play activity. If it's an academic demand, they may need to take a walk in a hallway if they're at school, or they may need a break from homework time at the table. They may feel very pressured by what they're doing academically at the table, and they need to remove themselves. Again, environmental demands. Are there things that we need, or do we need like a fidget toy? Do we need to move our bodies within our space? Our visual supports, visual timers and visual schedules are going to be really helpful if you have a child that gets very dysregulated quickly, because again, right, we're taking away some of that language temporarily and we're showing them picture choices or picture schedule, which helps them understand what are the expectations that I now have, right? Because sometimes if we're just hearing our schedule verbally, it can be difficult for that child to understand where's the end. Where's the finish line? But if we show them the finish line visually, they may be able to say, okay, if I do this one more time, it's done and I move on to the next thing. We also want to increase 3 Ps: processing time, proprioceptive input, and patience. So our processing time is while we're watching our child, right? Because we have to observe our child. We're watching the child process all of the cues. Remember, 8 sensory systems, a lot of things to process. If you give the child a choice, start counting in your mind to 30. and see if it takes a full 30 seconds for them to make that choice. That's processing time. What happens as adults is that we're able to multitask. We have these executive functioning skills. We're able to move through this quicker. Our children sometimes aren't, especially if they're already overstimulated. We need to intentionally give them more processing time. Just be patient and wait with yourself, okay? Proprioceptive input, remember, that's what I was talking about with the joints. It helps your body understand. Proprioceptive input is very calming. Vestibular input in our inner ear that tells our head where we are is very alerting. So if we have an overstimulated child, we're trying to bring them down, we need proprioceptive input. It's why weighted blankets are really popular. Weighted blankets provide proprioceptive input. Children and adults love them. So we need to calm our bodies down. But in bold, it says offer. Some children do not like to be touched. They're very tactily sensitive. This is not somebody that you give a bear hug to. Offer. Now you're going to, if you're talking about your own children, you're going to know this about your own children. But if you're seeing with somebody else's kid, offer to do these things. Okay, so when we're thinking about our environments, right? And we're thinking about, whoa, it seems like so-and-so gets very dysregulated when they're in this room, right? Think about this room. What do you see? What can you hear? What do you touch? What do you smell? Are you eating anything, right? What can you control in these spaces? Because we've got things that we can control and some of the things we cannot. But what is really active? When you walk into a room and it's all white walls and a white ceiling, it's going to be very bright, right? Your visual system is going to be very alerted by that. Are we able to buy a lamp and turn off the lights and have more of a calmer tone in there, right? The other thing is we want to think about the time. What's happening in your session, right? Me as a clinician, or in the child's day that's of high stress. Is it a high demand, right? And remember, academic demands, cognitive demands, social demands, right? Is this an area where there's a lot of kids around and there's a huge social demand? Is this an area that's really loud and it's a big environmental demand, right? Testing or homework can be very stressful. How can I make this situation calmer and less stimulating in a high stress situation? Transitions, that's going to be a great opportunity to use visuals, right? You know that the child's about to struggle when you have to leave their favorite place. We can use a visual timer, we can use a visual pictures, and we can let them know way ahead of time and prepare them for what's about to happen, right? Then they know the sequence, they know the end game. So, you know, what strategies can I use to decrease my arousal level? Visual schedules. I will always love visual schedules. Okay, so now that I've given you all of that information, we're going to kind of walk through it with a case study so we can practice. Okay, I have to move some of my pictures here. All right, so this is loosely based off of a former client of mine. So Jay is a 4-year-old boy with sensory processing challenges. He attends daycare for full day, 5 days a week, and he lives at home with his parents and his older siblings. Jay is described as a happy, wiggly, and excited child. His parents report that he is very playful, but sometimes is too rough with his older siblings. After school, when Jay's older sister is playing with blocks, Jay frequently runs through them, knocking them down and begins throwing them in the air. He does not respond to his sister's reaction, which is crying or yelling. Jay's parents report that he frequently cries and runs out of the room with TVs on. His parents report that at times he looks lost or confused and then out of nowhere will start to scream. Jay's teachers report that he's had incidents of biting, striking, which is also hitting, or running away, eloping, and his teachers are concerned for his safety. While playing at the community playground, he gets very excited by other children playing and will begin running in circles and yelling, but not engaging with them or his siblings. At the playground, he has difficulties responding to his name and leaving to go home. During meal times, Jay has difficulty remaining in his chair, but loves to try new foods. Jay's parents report that he has a difficult time settling for bed, and it seems like he never runs out of energy. So, what do we know about Jay? He's 4 years old. He has some sensory processing challenges. His parents report that he's roughhousing, has difficulty sitting with mealtime, settling for bed, And it seems like he's sensitive to the TV, right? They say that he runs out with his hands over his ears. His teachers are reporting that he's biting and hitting and running away at school. And in the community has difficulties following directions, transitioning, right? They said that he has trouble leaving and initiating play. Okay, so we're going to have 3 questions about Jay. So the first one is, how would you describe Jay's general arousal level and why? So I'm going to pull it up again so that you can read it if you want. Write in the chat whether you think that Jay is a low arousal kid, an optimal arousal kid, or a high arousal kid. Here we go. Okay, so it looks like we're getting some responses. High arousal, high. Ariel, I too would like his energy level. High, high, high. So yes, Jay is a high arousal child, right? He's described as wiggly. His parents say that it seems like he never runs out of energy. So he kind of lives at the very cusp of overstimulation. So when we're looking at this graph, we can see, I'm actually going to go back to the previous. So we can see, right, that optimal arousal window right in the middle, which makes sense, but it's not very small. I would say that your optimal arousal is between like 30 and 70%. So it's a big chunk, right? When we're low arousal, that's when we're really tired, really groggy, have difficulty getting up, getting moving. High arousal is when we have this overstimulation. So Jay's baseline is pretty close to overstimulation. He kind of lives in the high. Okay, what are Jay's cues that he's overstimulated? What are the signs that he's overstimulated? Pull it up again in case you want to read it. What are the signs that Jay is overstimulated? So remember in the beginning, we talked about overstimulation with the child is feeling dysregulation is what we see. So what is the child feeling so that we're seeing that he's overstimulated, that he's in a dysregulated state? Yes. Okay. So we've got wiggly, he never runs out of energy, running, not engaging, yelling, confused facial expression, screaming, not settling, running and not responding. Yes, those are Jay's cues that he is overstimulated. Right. So we've got that lost and pinned affect, anxious, we've got hitting, running, biting, crying, all of these cues that he's overstimulated and dysregulated. Great job. Okay, last question. When and where is Jay dysregulated? Yeah, getting some really great answers. So we've got room with the TV on at school. Yes, definitely at school, on the playground around other children, after school, right? A lot of you notice that it's when there's other kids around, right? At school, at the playground, at home with his siblings, playground, sometimes at the dinner table, right? So there's a lot of areas in Jay's life that he is dysregulated. So, right, at school, right, we've got instances of biting, he's running away at school, right? So think about when we're dysregulated, we're fight, flight, freeze, or fawn. So he is flight, he's running. We've got after school, he's probably been holding it together as best he can to try to get through that full day of school. And then he's explosive, right? He's running through his older siblings' toys and not even responding when she's crying or yelling, right? His impulse control, right? He's not paying attention that he shouldn't be doing that. At the playground, right? There's a lot of spontaneous social and environmental demands that happen at a playground. He's not perceiving what could happen, right? A kid running in, being very excited can over alert him, and then he starts running or he's spinning in circles. Someone picked up about mealtime, right? He loves to try new foods. So parents are really confused why he just can't sit at the table. It might be that he has to transition from what he was doing, whatever play or toy that he was doing, and then having to sitting may just be too difficult for him. He needs opportunities for movement, right? And then bedtime, really hard to wind down. Sometimes what happens is that children are processing what happened throughout their day and they rev up at night because there's so many things that they're thinking about and want to do or want to tell you that they're now able to have access, right? That top of the pyramid was behavior and academics, right? Being able to talk about their day might be happening at the very end, right before bedtime. And so it's difficult to wind back down. So yes, great job answering all those questions. Now that we understand Jay, what do we do? How can we help him? So, as I said before, the first thing you have to do is help yourself. We have to co-regulate before we can self-regulate. So not only when you are staying very calm, very neutral as best as you can, not only are you helping your child calm back down, but you're also modeling self-regulation skills. I heard a really good tip. I like these 3 W's. So we got 3 P's and we got 3 W's. So watch, wait, and wonder. Sometimes as the adults in our children's lives, we just want to help. We see them crying. We don't want them crying. We don't want them upset. And so we just have an action. But what if we watch, right? I said, observe your child. If it's not a safety thing and you're able to do that, if they need to get to put into safety, of course, put them in a safe place first, then watch. But let's watch the child. Wait, right? We need more processing time. That was one of our P's. Let's wait and see what's going on and wonder, instead of just assuming what the child needs, let's wonder about what could they be processing? What could be bothersome to them right now? What is pushing them over the edge and into this dysregulation? How can we avoid getting into that sensory meltdown? What is happening? And wonder. So then we have to come back to our pyramid thought, right? What do we increase and what do we decrease, right? So we're doing it otherwise. So we increase the things at the bottom of our pyramid. We increase, right? Our 3 P's, proprioceptive input, right? The heavy work, the weight, body weight, patience with ourselves and with them, and our processing time. Don't just start doing and doing and doing. Do that, watch, wait, and wonder, right? Our physical distance from the triggering stimuli. Sometimes we just need to leave the room for a little bit, and that can help us de-escalate so we can avoid that sensory meltdown. Again, our visuals. Let's increase our picture choices and decrease our language for a little bit so that we can use timers and other visual strategies. And our nonverbal cues. So, right, we're just taking away the language for just a little bit because it's just not helping there. That is too high of a demand right now. What gestures can we show so you can keep your body as relaxed as possible, keep your face as relaxed as possible, and show with your body language that you are here to help and you love and you're here to support. Okay, what can we decrease? Our demands. It's not just the thing that you're doing, but what are the cognitive processes? What are the social demands? What are the environmental demands, the academic demands? What can we scaffold and decrease, right? We don't have to just decrease everything. We don't have to shut it down if we're not at that point at a sensory meltdown, but what can we decrease so that we can just start to de-escalate? Our stimuli, right? Our verbal stimuli, talking, giving a lot of directions, doing a lot of narrating. Background noise is one that sometimes people don't think about. What if we just turn off that fan? What if we turn the volume down on the TV? Are we then able to calm ourselves down a little bit and then actually figure out what's happening? And our visuals, can we change the lights? Can we calm down our affect cues, right? And so we want to bring them down. The other one that's good to think about is the rate that you're doing the cues and the prompts, right? If you give a verbal choice, start to count to 30 in your head. It'll feel like a very long time, but remember, we want to increase our patience and our processing time. So would you like A or B? And then take a step back and start to count in your head. It'll feel like a long time, but maybe they need that much time. All right, so all together. So our overstimulation is when the body is receiving more sensory input than it can process from all of those 8 domains. And this can lead to dysregulation. Dysregulation can look like running, biting. It could look like a pinned affect. It could just be giggling and really giddy. That can be a sign of dysregulation and discomfort. We want to watch, wait, and wonder what is happening when we're observing our children in a safe way. And then when you're supporting a child that's dysregulated, help yourself first. Then start to use the sensory strategies. Remember, we can increase our proprioceptive input, our patience, and our processing time, and we can decrease demands. Less is more. Decrease the demands first, then see if they want some proprioceptive input. And that is all. So I'll take some time for questions and anything else. Thank you all for coming and participating in this presentation today.